So I started as an OBGYN, decided to go into OBGYN because I really wanted to develop the best possible, long-lasting relationship with my patients. And I thought you get the best of both worlds in OBGYN. You get to do surgery, but you also get to kind of continually care for that patient. It kind of morphed into urogynecology in the sense that I decided surgery was really my passion, and being able to do surgery was something I wanted to do on a regular basis. And urogynecology is great because what we're fixing is basically quality of life. The most common problems we see in urogynecology involve, overactive bladder, so going to the bathroom too frequently, having to run to the bathroom, going too urgently, maybe not making it to the bathroom in time, having leaking with activity, perhaps with a cough or a sneeze or a laugh or jumping or exercising. And then prolapse. Prolapse means something's dropping. Usually happens after you have children, although it can happen for people who've never had children. As far as in the office, right, we will treat overactive bladder and frequency and urgency. We first talk to you about things you do in your everyday life, what you eat, what you drink, can cause those problems. So sometimes the treatment is something you do for yourself. We can give medications. And then we can give more advanced therapies for that. We can do bladder pacemakers. We can inject Botox within the bladder. As far as leakage of urine with activity, that's a different problem. And in those problems, we typically can sometimes recommend physical therapy, so doing pelvic floor exercises, or surgery for that in the way of what's called a urethral sling, which is a simple same-day procedure that can be done relatively quickly and have very high success rates. As far as prolapse goes, we have very non-invasive treatments like pessaries, which can be put in the office to help lift those dropping organs, or we can do different types of surgeries. We can do minimally invasive vaginal surgeries, we can do robotic surgeries, so there's many different ways to fix those problems. So when you come see me in the office, first of all, we're going to talk in my office about your problems initially. So you won't have to go into the exam room right away. We'll talk in the office in a comfortable setting, in a very private setting, that we can talk very openly and honestly. Over time, they're going to develop the relationship like they do with anybody else and maybe feel more free to express some of their problems over time. But I can tell you from doing this for the amount of years I've been doing this, I have patients who frequently tell me how comfortable and at ease they feel in explaining to me what their problems are, and that I have a way of understanding what their problems are, and empathizing, and then providing that compassionate care. My philosophy of care is making sure that a patient is engaged in their care, right? You can't just have a provider who's going to say, this is what you need to do, and this is, do this and you'll be better. It has to be a partnership, right? I usually tell patients at the very first visit, look, today is a fact-finding mission, right? The mission of today is to figure out, make sure you understand what the problem is, right? Maybe what caused it, maybe not, but what the problem is, explain it in a way that they understand, and then be able to understand what their options are, and then make a decision. But in the end, what every patient has to remember is one of the options is to do absolutely nothing, right? These are, like I said, quality of life problems. If they're not impairing your quality of life enough that you want it treated, every patient has every option to say, you know what, I don't want to do anything right now. When it becomes more of a problem for me, at least I know where to seek that care. So we'll always give the patient the option to do absolutely nothing. If I can take care of a patient who has a problem that's impacting their day-to-day living and make that better, that's what inspires me. I mean, that's the primary thing that inspires me as far as being a physician. I think also being involved in education has been very, very, very big part of my career. Here at Inspira, we have an OBGYN residency, and be able to teach these residents the aspects of urogynecology and take that into their practice. I've done it previously with other residency programs as well as fellowship programs. And being able to continue to do that here at Inspira really allows you to take what you know, impart that on residents who are going to be using this education in their practice. And between the education and improving patients' quality of life, what could be more inspiring than that?